Hi. Today I'm going to talk about emergencies, painful emergencies. It's inevitable in our lives that we're going to have situations or times when we have maybe a severe toothache or a headache or a back problem or, gout or whatever. All these different things that can happen to us. And we don't have maybe ready access to a doctor or acupuncturist next door or, any therapeutic intervention. I want to share a simple technique which we all have access to, and there you go. Here it is. It's aluminum. Aluminum is a great electrode. It's a potent electrode, and unfortunately, it's not the best biocompatible electrode, but it works, and it works fine. In situations of, when you're in acute pain, give me aluminum. You'll find aluminum anywhere. Go to the kitchen, Reynolds wrap. Inside of an alcohol swab, you've got, aluminum right there. Or you got gum wrap, or you could use a gum wrapper. And you just look around, you'll find aluminum. And so, no matter where you are, unless you're in the jungle in the Amazon, you're going to find aluminum. And when you place the aluminum electrode, for example, let's just go here, a little bit of history. Back in 1999, I was introduced to an incredible therapy, Korean hand therapy. Now the whole body, it's called correspondence therapy, a microsystem of the whole body right there. Front of the body, the back of the body. And what you're seeing here, all these lines are the meridians, the energy pathways of least resistance. Now that's the least resistance for the chi or bioelectricity. And so the whole body there, here we've got legs. This is the front of the body. We've got arms here. And we have our head here. And if we have a neck problem, this is the back of the head here. This joint right there, there's C1 right there. We've got 7 vertebrae from that joint to the next joint. And all I have to do is take a pen and roll it along there and find a sore spot, mark that sore spot. That'll be a vertebrae that needs attention. It's that simple. A little bit of pressure, putting it on just down that bone, and it'll show up as tender points on the finger. You mark it with a pen and come back and simply place an aluminum electrode on there. That's treating a neck problem. Here, my right hand, I've got, there I'm treating a tooth problem. Right there, that's the head. That point there corresponds to points. And there it is there. I literally had a tooth problem. It's no longer there, and there's no longer an infection there. Planting an aluminum, I would just probe around. I'd use a small probe, feel around that area, find a sore spot, mark it with a pen, and plant an electrode there. Bingo, pain's gone. Not only, if you're using copper and aluminum, silver electrodes, in bio-electrode therapy we use copper and silver and gold and silver as electrodes. Simply because, as great as these are, I recommend the use of aluminum because it's so frequently available any place, anywhere, anytime, and it works great. But I don't recommend it as a routine use because of the silver ions, but it's a great it's a great stimulus for our semiconductor electrolyte body when you have an understanding of the meridian system and acupuncture points, of course. But even then, you don't have to have that. I have a book and I have an app with about 60 different painful, difficult diseases and conditions which shows you precisely where to put this, either the aluminum or the copper and the silver electrodes, or even the gold and the silver. Just to expand a little further, when you have a copper and aluminum electrode on our electrolyte body, it generates 2 volts, and 2 volts is a lot of voltage when we're dealing with microsystems and our delicate membranes and mitochondria and so on. But 2 volts will clear very rapidly and powerfully clear any meridian of any blockage or impediments or stagnation. And not only that meridian, but the connecting meridian as well. The use of copper and silver electrodes generates 0.46 volts, and that's more than adequate to clear a meridian or the paired meridian. So when you're using bio-electrode therapy, copper and silver, you can treat almost anything with the proper protocols using the proper polarity. When I talk about polarity, I'm talking the directional flow of chi in the meridian system. The meridian system is just an electrical grid, and the use of electrodes, we're just using electrical stimulus, bioelectricity. We're combining Western science with Eastern medicine, and we're creating a remarkable, powerful, amazing therapy. In the early days, I don't know, quite a few years ago, I would be treating hardcore drug addicts with acute opiate withdrawal, and I would tape on aluminum and copper electrodes on all the Jingwell points of the hand and the feet, and within less than a minute, you've got a person who is totally relaxed and comfortable with no evidence of any withdrawal pain. You're detoxing rapidly and quickly, but painlessly. But I've since I moved up the practicality, efficiency, and safety of the techniques, and now I use copper and silver and gold and silver, and they work great. And I've just developed very efficient application methods of using electrode paints, pure copper and pure silver paint, and I would let them dry and simply place tattoo tape, or I'm using silicone right now, and those electrodes typically will stay on for a day or two or longer. And so you're pain-free, addressing almost any imaginable pain in the body. But here we are talking aluminum. Here's a hole punch, and I would spend whole afternoons cranking out electrodes using this very simple office piece of furniture and a piece of aluminum. I would go to the dollar store and get myself these aluminum sheets for the oven sheets, and I'd put them out by the thousands. And I would go to a metal store and get copper sheets, pure copper and pure aluminum, and those were working great. But I've since evolved and improved and become more efficient and developed a whole lot more protocols. I developed Korean hand therapy protocols. I've developed tongue-style acupuncture protocols, so you don't need to use needles. You just have to place copper or, in fact, just silver electrodes on both these systems. You can use the ear. You can put, I use silver silver paint electrodes on points on the ear to treat tooth pain and any other pain in the body, just with that system. Tongue-style acupuncture has many, many protocols, and they have microsystems all over the body, so remarkable therapy. With a bit of a twist, you can use aluminum or copper and silver or gold and silver. But anyway, so the point of this session is simply finding a simple metal which is a powerful electrode, and all you need is silver when it's properly placed on the body. Get a chart, download a chart of Korean hand therapy points or the Korean hand therapy protocols, and simply use silver secured with a piece of electric tape, Scotch tape, pardon me, and bingo, you got yourself a powerful therapy. But again, with aluminum, it's not a biocompatible and not recommended for long-term use, but for short-term, days, week, whatever, go for it. You will have something that can be supernatural for rapidly relieving your pain. Anyway, that's a wrap, and I want to again thank you for taking the time to listen and learn. Be curious, and simply try it. My opiate withdrawal protocol is free on my website, www.bio-electrodetherapy.com, and you will find illustrations showing you precisely where to put the copper and silver electrodes on the hands and the feet and other parts of the body. But I expect, or I hope, or I'm planning to change the way we treat pain and misery and addictions. And at some point, our medical system it will have to embrace this therapy, because there is no toxic side effects, not even toxic side effects with aluminum, for short periods of time. It's great. But anyway, that's a wrap. Take good care. Good health. Thanks. Bye.